Good afternoon, everyone. Welcome to today's update on COVID-19 in Alberta. With us, as always, is Dr. Dina Hinshaw, Chief Medical Officer of Health for the province. Dr. Chia will provide a brief update, and then we will open the floor to questions.
Thank you, Tom, and good afternoon, everyone. Today, I'd like to provide an update on COVID-19 over the long weekend and talk about recent spread of the virus in Alberta. On Friday, we identified 154 new cases, and the provincial lab completed almost 11,400 tests. On Saturday, we identified 171 new cases and conducted more than 11,300 tests. For Sunday, we identified 137 new cases. On that day, more than 12,000 tests were completed. Finally, yesterday, we detected 157 new cases and conducted 12,561 tests, a new daily record for Alberta. Sadly, I must report 5 more deaths over the long weekend. This includes 2 residents of the Good Samaritan Southgate Care Centre. These residents had improved and were considered to have recovered, but their conditions then worsened and sadly they passed away. My sympathies go out to all who lost loved ones over the weekend, whether to COVID-19 or any other cause. I am pleased to report that more than 13,100 Albertans have now recovered. However, 45 people are now in hospital, including 10 in intensive care. There are currently 1,692 active cases in the province, unfortunately the most we have had since May 9th. I am concerned about the continued rise in cases. Our focus continues to be on limiting the spread of COVID-19 in the community and responding quickly to outbreaks when they occur. However, higher case numbers and more outbreaks can strain our frontline teams. We have posted new outbreaks today, including one at the Fairmont Hotel Macdonald in Edmonton. Currently, there are 7 cases linked to this outbreak. The cases are all among staff members, and Alberta Health Services is working closely with the hotel to ensure anyone at risk is isolated and tested as needed. At this time, no risk has been identified to hotel guests. As many of you know, a number of cases in school staff and students were among those reported this weekend. As I mentioned on Friday, this is not unexpected. In each case, AHS worked quickly with school officials to identify contacts and ensure anyone at risk is isolated. This quick action is crucial to keeping schools safe in the days and weeks ahead. I also know that getting told you have tested positive or are a close contact can be upsetting for these children and their parents. It is important that we talk to our children about what this means and what will come next. If your child is a close contact, they will need to isolate for 14 days. Testing can be arranged, though they will need to stay home for the full 14 days, even if they test negative. I know that it can be frustrating, after just a few days in school, that they already may need to stay home for 2 weeks if they are a close contact. This is understandable to be frustrated. At the same time, we need to approach these situations cautiously. Anyone exposed to COVID-19 could become ill at any point in the next 2 weeks, and a single negative test does not assure safety. As we gain more direct experience with COVID-19 in schools, we will continue evaluating our approach to assessing close contacts. At this point, all students in a classroom are considered close contacts if a classmate attended while infectious. We will assess that, as I said, and over time perhaps be able to adjust and amend that cautious approach. I also want to put these cases in context. All school authorities have returned to school as of today. In a normal year, this would mean about 750,000 students and 90,000 staff in 2,400 schools across Alberta. While not all students have returned due to some families choosing at-home learning options, the majority are back in class. Since September 1st, Alberta Health Services has reported to us 11 cases that were present at 11 different schools while infectious. This leaves approximately 2,389 schools who have had no disruption. None of these 11 cases acquired infection at school. Alberta Health Services is responding, and we are taking each case extremely seriously. But we also need to remember that there are no risk-free options with COVID, and that we must support every aspect of our children's health. We need to be nimble and continue adapting our approaches based on emerging evidence and the needs of schools and students. For example, as noted in Order 33, masking is mandatory for grades 4 through 12 outside of seated class instruction. However, we are allowing schools to implement enhanced physical distancing measures as an alternative to mandatory masking if a school can make sure that 2 meters is maintained at all times outside of seated class instruction. If this can be done, and if a school authority can submit a detailed plan showing how this distancing will be maintained, some schools may be allowed to not require masking indoors in the school. The Fort Vermilion School Division submitted such a plan last week for 6 of their schools, and I approved it yesterday. It includes aggressive measures, such as allowing only one cohort in a hallway at a time, staggering class transitions, and eliminating school transition times. We will be following up to ensure that the plan is working as intended and that there is no risk to the students. We will also continue to closely monitor the spread of virus in schools and adjust as needed to meet local needs. If needed, we will make adjustments to our school models in all locations in Alberta in the weeks ahead. We have committed to being as transparent as possible with Albertans. We are developing additional online reporting tools to help keep the public better informed on school cases and outbreaks, and I look forward to sharing these with you in the very near future. I know that this is a stressful time for many. I've heard that returning to in-person or online learning has brought familiar comfort to some families and added stress for others. As parents, we need to help educate our children on the public health guidance for back to school, including being masked and following physical distancing rules. Particularly critically, every day, we need to ensure our children are healthy and keep them home if they are unwell, even if they are only feeling slightly unwell. I have also been told that many students, especially older students, have been congregating after school, sharing drinks and in close contact with each other without masks. Even if schools operate perfectly, there is a responsibility for parents and students to make sure that the same precautions are followed outside of the school. I recognize that a lot of information is coming quickly from teachers, schools, and from public health workers. It is a lot to take in and can certainly add to the stress. That's one of the reasons I have written an open letter to all parents in the province. This letter includes information on public health guidance for schools, clarification on masks and physical distancing, suggestions for preparing your child for in-school learning, and more. The letter has been shared with school authorities, and parents should receive written copies shortly. I'll also post it online and via social media later today. We all need to support each other as we enter this new phase of our pandemic experience. The more we can listen to each other's perspectives and find common ground, the better positioned we will be to succeed. Currently, the cases in school appear to be from community transmission. They are not linked to transmission within the schools. This is another reminder that one of the best ways to keep schools safe is to bring down our community transmission rates. With the rise in active cases, we are looking closely at trends and locations of exposure throughout the province. One of the things that is showing up is a higher percentage of new cases that are close contacts of known cases. I know that one of the things that will help with limiting spread from cases to their close contacts is improving our turnaround times to get results back to those who have been tested. As I have said before, Alberta Health Services is working extremely hard to accomplish this. Having said this, another pattern we are seeing is that those who have mild symptoms of sore throat, runny nose, or nasal congestion are not consistently staying home when those symptoms start. I know that it is inconvenient and possibly irritating to stay home with a mild illness, but it is absolutely critical that we support each other to do this. What is a mild, short-lived illness for one person can be a life-threatening risk for others. with long-lasting health consequences. Whether we like it or not, we are all in this together. This also means we need to think about systems that support people to stay home. How can we make it as easy as possible for workers to stay home when sick and still be able to pay their bills? How can we make it easy for parents to keep mildly ill students home without consequences for the student's learning or the parent's job? These are the challenges we must face together to avoid having to take any steps backwards, which none of us want to do. I have been asked a lot about pandemic fatigue. The first case of COVID-19 was diagnosed in Alberta over 6 months ago. That is a long time to be faced with stress and uncertainty. It is a long time to hear about all the things we need to do and all the things we can't do anymore. It can feel even longer when there doesn't seem to be an end in sight. I know that life in a pandemic is tiring. It's important for all of us to find a way to take care of ourselves. With shorter and cooler days ahead of us, I encourage all of us to start thinking about what we can do for self-care in the months ahead. Maybe it's connecting with loved ones, or becoming more physically active. Maybe it's arranging a virtual get-together with friends you haven't seen in a while, or maybe it's taking time to read a good book. I encourage all of us to find something that will help refresh and strengthen our resolve to continue doing the right things that protect our neighbors, our families, and ourselves. We continue to see a rise in cases, but we are not powerless here. Together, we can reverse the trend. We are in this together, and we will get through this together. Thank you, and I'm happy to take questions.
All right, we'll go to the phone now. In addition to Dr. Hinshaw, we also have Andre Corbould, Deputy Minister of Alberta Education, here to answer questions if needed. There is a large number of questions in the queue today, so if you could please keep it to one question each, that would be greatly appreciated. Operator, could you put through the first one, please?
Yes, first is Jeff Slack with 660 News.
Hi there,
Go ahead, Jeff.
Hi there, Dr. Hinshaw. We had 7 schools yesterday and 5 today that said that they had found COVID-19 cases. Does this signal that we should look at the school model and make a few adjustments now, or would we need to update the plan if there were multiple cases within one school, so sort of an outbreak setting?
It's really important to distinguish between schools where members of that school community may have been identified as a case, but were never in the school while infectious. And that certainly is some of the cases that are being reported. And those, again, are not a danger or a risk to the school. There's also the cases that the 11 schools that I referenced, that a case has been identified where they were present in the school while infectious. And we are following up. Alberta Health Services is working with the schools to follow up and make sure that anyone who was in close proximity to those cases does need to stay home for 2 weeks. It is very early to be able to say. Of course, at the present moment, we've had no cases of COVID-19 that have acquired that infection in school. We will be watching closely for that over the coming days. I think it's important to remember 2 things. One is that the school will reflect the transmission in the community that it is a part of. So we know that in places where community transmission is rising, that we will see cases coming into schools, and our job is to prevent that from spreading in the school. But it is also our collective job to try to bring that community transmission down so there is less likelihood of introduction into the school. The second thing that I would say is that we have had childcare cohorts operating at 30 people between children and caretakers since the middle of June. We have had very, very few outbreaks, and of the outbreaks we have had, there have been very few cases in each of those. I think, again, what we need to focus on is keeping schools an environment where our children can learn productively, where we minimize the risk of introduction by collectively minimizing community transmission, and where we minimize the risk of spread in schools by active case follow-up and managing these exposure potentials through quarantine of close contacts.
Operator, can you put through the next question, please?
Next is Don Braid with the Calgary Herald. Go ahead, Don.
Dr. Hinshaw, there's a website called Support for Students, and it's a well-known advocacy group, and they're listing over 20 cases, actually about 25, but over 20 cases that are coming in almost by the hour of people in schools having been diagnosed or people with contact with schools having been diagnosed. I wonder if you place any credibility on that, first of all. And secondly, it doesn't jibe at all with your figure of 11 cases in school, 11 schools being involved in cases where I think you say there could have been transmission. How do you account for the disparity? And secondly, the NDP called today for a website to put up every single case that appears in or related to a school daily, so parents can look and see if their school is still COVID-free, rather than leaving it to social media and to websites, which obviously don't know everything, to pass this information out.
Thank you for that. The site, the Support Our Students site, is something that I'm aware of. And again, I would distinguish between the total number of cases that have been identified in an individual who is a part of a school community and those cases where after investigation it's identified that that person was in the school while they were infectious. So for example, if you have a student in a school who became ill and went for testing, but actually wasn't in the school for the 2 days prior to that illness onset. Yes, there's a case in that school environment, but if they didn't acquire it in the school and they didn't transmit it or couldn't have transmitted it into the school environment, it's not counted in those 11 schools that I'm speaking about. And again, to be clear, the 11 that I'm speaking about today are those that Alberta Health Services has indicated to us that they've followed up with their investigation. There could be additional schools that they are currently working on that they haven't reported yet to us. So I would suggest that it's possible that there are a couple of reasons that that number could be higher than the number that I have. One is a delay in reporting, and the other is that that site may actually be indicating all of the schools where there was a case in that community, whether or not there's any risk of spread in that school. With respect to the request to have more regular reporting on schools, we have committed and made clear in the requirements for school follow-up of cases that were infectious while in a school that a letter will go out as soon as possible to all parents and staff of that particular school as soon as it's identified through the investigation that there were any exposures in that school environment. So parents absolutely would not be receiving this information through social media, that it would be a direct communication from the school to those parents and staff who should be the first to hear if there is a potential exposure in a school. Following that, what we are working on is a website that will have lists of all schools where there are outbreaks of more than 5 cases. And we are looking at adding some additional information around the schools that have alerts. Again, that's just where there is a single case that has been infectious. Now to be clear, that doesn't indicate that transmission has happened. And in fact, the measures that are in place in school would ideally make that unlikely. But we are being quite cautious with respect to our approach in requiring students to stay home if they've been have had the possibility of being in close contact with that infectious case. So we shouldn't confuse the being in a school while infectious with transmission in a school environment. Those are 2 very different things. So the website that we're working on will provide information on the school alerts, the schools where there are 2 or more cases or where there is some early identification of transmission. And to be clear, we have no schools where that is the case right now. And then there will be, again, that listing of all the schools with outbreaks of 5 or more. And we are working to get that up and running very soon, but it isn't quite ready for release today. We, again, are working as fast as we can to make that available to the general public. But again, I want to come back to my first point, which is that parents and students and teachers associated with a particular school will get direct notification from that school. And that is the most important, that they hear directly when there is any potential for that information to be shared about their own individual school.
All right, operator, could you put through the next caller, please?
Next is Kevin Nimick with CTV. Go ahead, Kevin.
Hi, Dr. Hinshaw. I just want to follow up on Don's question. I don't think you answered the portion around the NDP's demand that single cases at schools be publicly reported. You said that they're not, but why aren't they publicly reported? Why don't parents at other schools have the right to know that there are lots of schools in their neighborhood or in their city that have cases, even if they don't directly have a kid at that school?
So we have, with our outbreak reporting, been our intention is to be as transparent as possible with outbreaks. But if you think about the analogy of if we had a single case who attended a business or who attended any kind of a gathering, potentially while infectious, we always follow up with any close contacts, as we would with any investigation. We don't put the names of every business location, of every gathering where there was a single case that attended. We follow that up internally. And so in terms of consistency, anyone who is potentially at risk is directly notified. And so as we were working on our school notification framework, we really wanted to, again, showcase that consistency. Having said that, in my response to the earlier question, I did indicate that we are looking at making the information on school alerts available on this new school reporting website. What we are currently working through is to determine whether naming each school that has an alert is appropriate or whether it's aggregate reporting by area that would be more appropriate, again, given that an alert simply indicates that someone who has COVID-19 attended a location while infectious. It does not indicate ongoing exposure risk. And again, that's consistent with how we manage long-term care outbreaks, where we do have early response with even a single case, but we don't publicly report until there's evidence of transmission within that particular facility. So we're trying to be as consistent as possible, giving information for those who need to know who are at risk, and then allowing public information to be as transparent as possible while not violating confidentiality.
Operator, could you put through the next question, please?
Next is Rick Bell with the Calgary Sun. Go ahead, Rick.
Good afternoon, Dr. Hinshaw. I just want to get a little clarity here. We're seeing and hearing a lot of fear and loathing over this whole school reopening, and there are people telling us that things are already falling apart quickly, that the government plan is not working and the government plan cannot work. It's impossible, that things are becoming downright frightening. And to use a phrase my old man used to use, that things are going to hell in a handbasket in a very quick way. I just want to know, since you know and I don't, what is the reality of the situation? Is that the reality, or what is the reality? Because those messages are getting back to people, and people get very afraid when they hear that day in, day out, hour in, hour out. So I'm just wondering what the reality of the situation is.
From my perspective, the reality of the situation is that we do have slowly increasing community transmission, and that with slowly increasing community transmission, there is a higher likelihood that we will see cases in schools. With the cases that we've seen so far in schools, and even if the 11 that I've been informed about by Alberta Health Services, if there are others under investigation that will even double that number, that's still the vast minority of school settings in the province. We have known that with opening schools in person, it was absolutely expected that there would be infectious cases in schools because there are infectious cases in our communities. Again, that's not surprising. And it's too early to say whether or not the current school model will be sufficient to protect against all transmission. I expect we will have some low levels of transmission. And I've been very clear in the last few weeks that returning children to school in person cannot guarantee a zero COVID risk, and that each family must make those decisions for themselves because each family has a different set of circumstances that will make COVID-19 exposure more or less risky for them. And so some families have, of course, chosen to go with remote learning. Others have chosen to send their children back to school. And the reality is that we have to learn to live with COVID, and we have to learn to balance the risks of occasional exposures with the risks of keeping our children home, keeping our children out of school in person, which has other long-term risks for their health and well-being. So again, that's the long answer. The short answer in my perspective is that The current situation is not unexpected. It's too early to be able to give an evaluation of our school model. We will be watching closely, and if our community transmission continues to rise, we may need to look at other models in certain high transmission areas. But we want to make sure we're giving every opportunity for students to have a successful return to school with everything we can provide in this model before we accept some of the risks that would come with any alternate model.
I believe Deputy Minister Corbould has a supplement to that answer.
Thank you. Yes, Rick, I just want to add to what Dr. Hinshaw has said, that I've been in touch with several superintendents over this past weekend with the evolution of some of those cases that have happened. And I think it's important to understand that Alberta Education's monitoring the situation very closely with AHS. There are clear protocols in place to manage the cases in school, including when and how parents should be notified, as described by Dr. Hinshaw. The reality on the ground, from my perspective, has been one of calm, deliberate, concise decision-making. I certainly know that the challenges the pandemic have brought to schools across the province here, and no doubt we're going to have moments of frustration and anxiety. But the reality is we're responding to those incidents very calmly, very deliberately, and very quickly. We have a very strong reentry plan, and we know schools and staff are working hard every day to ensure their schools are safe. And I would just finish by saying, over all my calls over the weekend, there weren't any questions about what needed to be done when these cases were identified. It was just clear notification of what those school boards were doing based on the reentry plan that they have, and they know and they understand. So I would say the reality on the ground is one of calm. Thanks.
Operator, can you put through the next caller, please?
Next is Carlisle Fissett with CTV. Go ahead, Carlisle.
Hi, a question for Dr. Hinshaw. We've heard of close to 50 staff at the Misericordia Hospital in Edmonton who can't work because of possible exposure at a retirement party, which is not a good luck for the hospital. It's gone through a deadly outbreak already. What's your message to healthcare workers about gatherings like these, and how is the MIS coping with such a sudden and significant loss of staff for up to a couple weeks?
That particular instance, I don't have the details of, but what I can say is that not just healthcare staff, but anyone, if you're attending a social gathering, particularly if you're working in an industry where absence of many staff all at the same time could be a significant blow. So example would be, again, school staff, as you say, healthcare staff. So anyone who's attending a social gathering needs to be thinking about the possibility of COVID exposure, and all of the protocols that are in our guidance that I've talked about many times need to be followed, whether at work or at home. And again, I mentioned that earlier. We've seen with school reopening that students who are understandably excited to see each other are perhaps forgetting that COVID-19 doesn't just live in the school. You know, the risk is probably higher as they step out of the doors and then start to congregate socially. And the same would be true, again, of any individuals. So it really, the same message would be for anyone to be thinking about, if you're at a gathering and you think, what would happen if someone here were to be infectious? And if you look around and think, we would all be close contacts, well then the approach needs to be changed. Ideally, you would be planning even before that so that any kind of a gathering would not be a risk of COVID spread. And it really is something that we all have to be thinking about every day as a part of all of our routines.
All right, operator, could you put through the next caller, please?
Next is Julia Wong with Global News. Go ahead, Julia.
Hi, Dr. Hinshaw. Just a quick clarification before my question. In regard to the outbreak at the Fairmont Hotel McDonald, were the employees infected by a common source at work, or was there something that happened outside of work? And my question is, Ontario is pausing the loosening of public health measures as case numbers go up. BC is looking at bringing back restrictions now that it's experiencing a second ripple. Both provinces are in different stages of relaunch, but the common theme is acting when case numbers go up. Alberta has seen rising case numbers for a while now, and that will only compound with kids back in school. Does Alberta need to bring back restrictions now?
Thank you for that. So the Fairmont outbreak is under investigation. It's not clear what that source was, whether it was an on-site common source or if there's possibility of an outside, an off-site source. That's currently part of the investigation. With respect to looking at Ontario and BC and the measures that are being put in place there and any measures that might need to be put in place in Alberta, certainly it's something, again, as we look at our cases, we look at our trends to determine whether or not we need to be putting any kind of measures in place. I think that we have seen case counts increasing over the past couple of months. We've seen some interesting trends where cases sort of have risen up a little bit, have gone down again, have risen up a little bit. We haven't seen to date a steep acceleration of cases. Having said that, we can turn the corner very quickly if we aren't collectively able to change the patterns. And so that's one of the things that we're looking at right now is what are the trends about the transmission patterns. And some of them, quite honestly, aren't really that amenable to formal restrictions. There are things, again, like close contacts and how we can stop transmission from happening within a household, or social gatherings, where, again, it's perhaps not even a large number of people, but there's just no precautions being taken. And those are difficult things to put in formal restrictions on, which is why if we want to have the biggest impact on our numbers, it has to be that collective effort with all of us digging in. And if we identify some of those trends that we may need to, for example, alter our guidance or take other specific action, we absolutely will do that. And one particular example is I note that while the vast majority of faith-based locations have been able to open since June and we haven't had significant outbreaks, in the past couple of weeks we have had several locations where we've identified significant spread. So I will be meeting with faith leaders in the coming weeks to have a conversation about how important it is that as leaders of those faith communities, the precautions that are outlined in our guidance are put in place in a way that is regular and reinforced by that leadership. Not because all settings have had problems, but because we have seen a few, and it's an opportunity to remind those individuals. So, ultimately what Albertans have told us is that that they're willing to pull together if we just tell them how exactly to do it. And so we're providing the guidance and looking to Albertans to pick up the traces and all pull together to get this done.
All right, it's coming on 4:10, so we have time for 3 more questions. Operator, could you put through the next one, please?
Next is Shannon Scott with CBC. Go ahead, Shannon.
Oh, hi, Dr. Hinshaw. You've touched on this a little bit, but I'm hoping you can extrapolate a little for us. We're curious as to why there are some classes where a positive case has been found in that class, where the whole class is being told to isolate for 14 days and others are not.
I don't have all the details of all the schools and all the exposures. I get the general reports that come from Alberta Health Services. Typically what happens when there is a positive case identified, if that case attended a school, if they were on site while they were infectious, then the investigators typically see where they were, who else they were with. And it depends to some extent if the case is in a student or in a staff, and how close they were to each other. In our guidance documents, the definition of a close contact is someone who has spent 15 minutes or more closer than 2 meters to that case while the case was infectious. In a classroom environment, our current approach, which is very conservative, is in order to have a very rapid response, in most cases where there's a student case that was infectious while in a classroom, in most cases, that entire classroom would be asked to quarantine at this time as we evaluate that approach. Going forward, we may find that we don't need to exclude everyone, but right now we need to do this so that we gain an understanding of how best to identify those who are at risk. And so again, those are the general pieces of information we provided in our guidance. And at the local level, Alberta Health Services works with the school to determine who needs to be excluded after an exposure.
Operator, could you put through the next caller, please?
Next is Andrew Walker with 88.1 FM. Go ahead, Andrew.
Hi, Dr. Hinshaw. With almost all junior and high school sporting events canceled due to the pandemic, I was wondering later on, maybe even in the winter, is it possible to have crowd-free tournaments similar to the NHL or the Canadian Premier League where the host facility would have testing or symptom checking for all student athletes and staff?
We've heard keen interest in school sporting events, and our guidance for sports, so the sports cohort model, is something that schools can use. So it's possible, if schools are able to follow that cohort guidance, that they would be able to have sports go forward. With respect to the bigger tournaments, I think what we would need to know is specific proposals that would be for an event that someone would want to host, to understand what are the measures that would be proposed to be put in place. And then we could look at that and make sure that if the risk of spread could be mitigated, we could potentially then work towards having an agreed upon solution. At the moment, again, what we're focused on is that 50-person cohort, and making sure that students can play sports, but just play sports in a way that doesn't risk widespread transmission across many, many teams.
Operator, can you put through the final question for today, please?
The final question is Dylan Short with Post Media. Go ahead, Dylan.
Hey, Dr. Hinshaw. Over the last myself and other government officials made it quite clear that we would have cases in schools. I was wondering, were we expecting cases this soon and at this rate?
It's a good question. I think we have had cases in children, all along through the pandemic. We've seen cases in the last several weeks in multiple age groups. So it isn't surprising that we have had cases in schools. With respect to the numbers or the rate, again, I think everyone is still getting used to the new protocols. I think the piece that was perhaps somewhat what I would have wished to see differently is the number of cases we've seen that attended school with mild symptoms. And I think we need to do a better job of communicating to students and parents the expectation that even mild symptoms mean staying home from school. Because I think that was the one piece, I think, of the cases that have been reported that mean that again, we need to do a better job at translating that expectation, that it's not just if someone is severely ill that they stay home, but they do need to stay home while mildly ill.
All right, thank you for joining us today. Dr. Hinshaw will provide another update tomorrow afternoon. Have a good day.